Heroes of History, Ben Carson, A Chance at Life by Janet and Geoff Benge. Chapter 9. Things seemed to fit into place. July 6, 1975 was one of the happiest days of Ben's life. It was his wedding day. Candy had recently graduated from Yale, and it was now time to start their life together. Ben was 23 and still had years of medical training ahead of him, but he was sure those years of study would be easier with Candy at his side. They'd had long discussions about how consuming Ben's next few years would be and how little time they would have to spend together, but Candy insisted that she did not mind. Because Candy loved to be involved in things and out meeting people, Ben was confident that his new wife would not be sitting at home feeling lonely. Following their honeymoon, Ben and Candy rented an apartment in Ann Arbor, right across the street from the medical school. Candy soon found a job working at the state unemployment office, while Ben prepared for his third year at medical school, where he would be in the hospital wards and the operating room. Just as Ben had predicted, Candy found many other things to keep her busy. In no time at all, she was an indispensable member of the church, teaching a Bible class for teenagers and starting a children's choir. She also joined the Ann Arbor Symphony, where she played the violin. In Ben's third year of medical school, one of his first rotations was in neuro or brain surgery. On his first day, he suited up in his white surgical garb, washed his hands and arms under the faucet of running water, and pushed open the operating room door with his back. For a split second, he felt like Ben Casey, the doctor from the television show he had watched as a child. Once in the operating room, Ben's pulse quickened. He watched as the surgeon drew a line across a young girl's shaved head, from her right ear to the top of her head. Then, using a scalpel, the surgeon cut the scalp along the line and pulled it back to expose the skull. Holes were then drilled into the skull, and a special saw was used to cut the skull bone between the holes. Gently, the surgeon removed the piece of skull bone to expose the dura mater, the protective membrane that surrounds the brain. Although it was the first time Ben had observed brain surgery, as he watched the surgical scissors slowly cut through the dura mater, he could already envisage what the brain beneath would look like. Sure enough, the unique twisting structure of the brain cortex was soon revealed. Ben marveled at the sight. That afternoon, Ben talked with several of the other students who had been in the operating room with him. One of the students complained about how difficult it was to work on the brain. Once the skull was opened up and the surgeon began to operate on the brain, the tissues moved around. It was easy to become disoriented as to where you were inside the brain. Also, it was difficult to distinguish normal brain tissue from the tumor the surgeon was trying to remove. Ben frowned as he listened to the student's complaint. Where his fellow student had seen an obstacle, Ben saw a challenge, and he thrived on challenges. While Ben had harbored dreams of becoming a psychiatrist when he first thought of being a doctor, that night he talked with Candy about his interest in the challenges of neurosurgery. He explained how things seemed to fit into place. Since junior high, he had been interested in how the brain worked. He also knew from his experience operating the crane at the steel plant 2 summers before, as well as from his unbeaten record in foosball back at Yale, that he had excellent hand-eye coordination. This was important for something as delicate as brain surgery. By the end of his conversation with Candy, Ben had made up his mind. He would become a neurosurgeon. Yes, he would still be working with people's minds, as he always planned, only in a different way. He knew this meant committing to 1 year of general surgery and another 5 years of neurosurgery before he would qualify as a neurosurgeon. The length of time did not matter to Ben, who was just grateful that he had found the direction he'd been looking for in medicine. A week later, Ben watched another surgery. This time, the patient was a middle-aged woman suffering from a condition called trigeminal neuralgia. Ben watched as the neurosurgeon made a small opening in the mastoid bone behind the ear. "I'm looking for the foramen ovale, the surgeon said. "Then I can locate the trigeminal nerve." He turned the scalpel slowly and peered into the operating microscope. "It's not easy to find the foramen ovale. In fact, sometimes it's the hardest part of the operation. Can you tell me about it, Carson?" Ben thought for a moment, then said, "The foramen ovale is one of the larger of the several holes that transmit nerves through the skull. It's situated in the posterior part of the sphenoid bone, posterolateral to the foramen rotundum. The mandibular nerve, the third branch of the trigeminal nerve, the accessory meningeal artery, the lesser petrosal nerve, emissary veins, and the otic ganglion are all transmitted through it." "Good work," the surgeon said. "And trigeminal neuralgia?" he asked, still peering into the microscope as he slowly probed inside the woman's skull with a long needle. Ben was glad he'd spent so much time studying his textbooks. He knew exactly which page in the book explained the condition. "It is a chronic condition that affects the trigeminal nerve. The condition is sometimes called the suicide disease because the facial pain it causes is so severe that patients want to take their own lives. In fact, it's thought to be one of the most severe forms of pain known to man." "Right," the surgeon said. As he watched the surgeon search for the opening, Ben thought, "There has to be an easier way. I bet I could come up with something." He stopped himself short. Sometimes other students joked about how cocky he was, and now he wondered, am I being too sure of myself? This man is a well-respected neurosurgeon at one of the top teaching hospitals in the country. Don't you think if there were an easier way, he would have found it already? I'm new at this. I need to keep my mouth shut and learn all I can. But the voice inside Ben's head did not quiet down. There has to be a better way. The surgeon is wasting valuable operating time. Once the surgeon located the foramen ovale, Ben became engrossed in the operation. However, he left the operating room determined to find a way to make the procedure more efficient, and he already had an idea. In the summer of 1974, he had worked as an X-ray technician. And now Ben wondered if there was a way to use the X-ray equipment to help locate the foramen ovale. On his next morning off, Ben visited the radiology department and talked to his friends there about his idea. The head of the department gave Ben permission to use their equipment to experiment. Soon, Ben came up with a simple technique he thought might work. It involved placing two small metal rings on the skull, one at the front and the other at the lower back, behind the ear where the foramen ovale was located. Then Ben passed an X-ray through the skull so that the beam passed through both metal rings, adjusting the patient's head until the foramen ovale was clearly visible when the X-ray passed through the two rings. Now, a surgeon had a way to accurately locate the foramen ovale. The approach was simple and straightforward, so simple, in fact, that Ben began to doubt his idea. If it's that easy, why hasn't someone else come up with the technique? He decided not to tell anyone about it until he could try the approach himself as soon as he had the opportunity. When the opportunity arose, Ben was pleasantly surprised to find that by using his technique, he could find the foramen ovale more quickly than any of the veteran surgeons he had observed. Ben tried the procedure twice to make sure it wasn't beginner's luck, and when it worked a second time, he showed his neurosurgeon professors what he was doing. The head professor was impressed. "Ingenious, Carson. It's hard to believe no one came up with that earlier. But good for you for thinking it through," the professor said as he patted Ben on the back. Ben felt great and pushed himself to study harder. He wanted to know everything he could about brain surgery and then work on new techniques to solve the problems that came up. He was more energized than ever to be the best neurosurgeon he could possibly be. Ben learned so much during the next year. The interns and junior residents, who were both ahead of Ben in seniority, began asking him questions and relying on him to answer their calls while they took well-deserved naps in the residence lounge. Everything was going according to plan for Ben, who expected to do both his internship year and his residency in neurosurgery at the University of Michigan. Then he overheard a conversation that changed his direction. Ben was waiting for a report when he noticed an instructor talking to another doctor. They both had their backs to him, but they were speaking loudly, and Ben could easily hear what they were saying. "The chairman of neurosurgery's on his way out," Ben heard the instructor say. His ears pricked up. "Do you think it's that serious?" the other doctor asked. "I'm afraid so. He told me himself. Too much politics and backstabbing." Ben's heart sank. As a student, he was aware there was some strife in the neurosurgery department, but he did not realize it was that serious. Now he knew it was. Soon the news came out that the head of the neurosurgery department was leaving. Given this turn of events, Ben considered his options. He wanted to stay focused on his studies, but he suspected that the transition to a new chairman of the department would be difficult, and that many doctors would have their loyalties tested. Because Ben did not have time to be involved in such drama, he began looking for alternatives. One option that came to mind immediately was Johns Hopkins Hospital in Baltimore. From what he knew firsthand, and from what he had read about the place in medical journals, Ben was impressed with their medical program. He decided to apply there. His grades were excellent, and he had received several awards for his innovations. But would that be enough to gain entry into the neurosurgical program? Ben wasn't sure. The problem was that about 125 medical school graduates were competing for the 2 neurosurgery slots available. Still, Ben sent in his application and soon learned that he had gotten to the next step, an interview. "Come in, please," Dr. George Udvarhelyi, head of the neurosurgery training program at Johns Hopkins, said. Ben entered the large office. As he took a seat across the desk from the doctor, he noted the antiques that decorated the place. "So tell me about yourself," Dr. Udvarhelyi said in Hungarian accented English as he lit his pipe. "Johns Hopkins is my first choice of medical programs," Ben began. "In fact, it's my only choice. This hospital is where I want to be studying this fall." Ben was thinking hard as he spoke. There was a lot riding on the interview, and he didn't want to say anything that might hurt his chances of getting in. "And why did you choose to become a doctor? What aspirations do you have? What are your primary fields of interest?" Dr. Udvarhelyi kept plying Ben with questions. In the course of the conversation, the doctor mentioned that he had attended a particular classical music concert the night before. Ben had been at the same concert and told Dr. Udvarhelyi so. "You were at that concert?" the doctor said with a surprised tone in his voice. "Did you enjoy it then?" "I did, though the violin soloist was not as good as I expected," Ben replied. Dr. Udvarhelyi's face lit up with a broad smile. "You are right. I thought the same. The soloist was technically fine in his playing, but somehow his performance seemed flat." Soon, Ben and Dr. Udvarhelyi were deep in conversation about classical music. When he had received word that he would be going to Yale to do undergraduate pre-med, Ben had used his time before leaving for New Haven to learn as much as he could about the arts and humanities. When he got to Yale, he had hoped to get on the school's College Bowl team and compete with other universities on the television program. Because he knew you needed a broad general knowledge base to be on the team, he had set about filling in many of the gaps in his knowledge. One of those gaps was classical music, a subject he had noted came up time after time on the show as contestants were asked about some classical musician or composer. All Ben's study had proved fruitless, however, because the year Ben started at Yale, the College Bowl television program was canceled. But now, as Ben sat talking to Dr. Udvar Helye, all that he had learned about classical composers and musicians came back to him, and the two of them got deeper into conversation on the subject. Before Ben knew it, they had spent more than an hour discussing classical music. When the interview was over, Ben left Dr. Udvar Helye's office a little unsure what to think. He and the doctor had obviously bonded over classical music and had talked about it far more than they had discussed Ben's medical background. Ben wondered if that might count against him. After all, he was applying to become a neurosurgeon, not a music critic. Ben need not have worried. He soon received word that he had been accepted as a resident into the neurosurgery program at Johns Hopkins. He was elated. He was going to get to study at what he thought was one of the best hospitals in the United States and probably the world. At the beginning of fall 1977, Ben and Candy moved to Baltimore. While Ann Arbor had been a quaint university town, Baltimore was big and bustling, and it felt good to them both to be living in a big city again. Candy soon landed a temporary job at the Connecticut General Insurance Company doing clerical work. Later, she managed to get a permanent job as an editorial assistant for one of the chemistry professors at Johns Hopkins University. Because she was employed at the university and Ben was an intern there, Candy was eligible to take classes for free. Ben was delighted when she told him she wanted to earn a master's degree in business. He knew the next few years of training would take most of his focus and energy.